My proposal is non-tuberculous mycobacterial disease program associated with bronchiectasis. If we couple these two disorders together, there is an ever-increasing awareness as well as an increasing need because of its increased prevalence throughout the country. The present setup, although okay for a regular community-type medical practice, is not a good setup in this particular disease pattern to and give excellent care in a more streamlined manner. The intent and the goal of this proposal is, in a way, to convert what program we have from a medical office concept, a clinic concept, to a programmatic concept, which would entail the use of the resources that we already have at UMC, but do it in a streamlined manner with a care coordination in a one-stop, one-window stop operation. We see anywhere from 14 to 17 patients per clinic day. And if I were to give you a rough idea about the unique number of patients that we are following, it may fall around about 100 or so. When I see them, I try to do a good job of evaluating them in the clinic. But then I have to go through a certain process of establishing their care, getting other tests done, and that's where the fragmentation of care comes. The way I envision is I register that patient. They walk in the morning, they will go through and have a truly navigational assessment throughout the system from point A to point Z of all the things they need. The treatment also will be started during that. Any issues with the treatment will be handled during that time. If they need something the next day, they'll come for the next day. It's an outpatient thing. It's not going to encroach on inpatient capacities. So I have this acronym called STEPS, S-T-E-P-S. Do I have the space? The answer is yes. Do I have the time? T. The answer is yes. Does it need any special equipment? No, it doesn't need it. Does it need any personnel? Yes. It will fail if I don't have the support of the personnel, and that is what I have asked for. The last S can be converted into dollars. If the investment in personnel is X, we will recoup that X cost very, very shortly. So the ROI of that is tremendously positive. And so I believe that this thing is in consonance with the mission of UMC. It is also using all the infrastructure that we already have. And at the same time, it matches with the mission of patient care, academic excellence, graduate medical education and GME training, and the research mission of the university.